Hey guys, welcome back to MBBS Atlas. So, in today's video, we'll be talking about the anterior triangles of the neck. So, in the last video, we have talked about the posterior triangle of the neck, right? So, if you have not seen the video, please do check it out. The link is in the description box. So, in yesterday's video, we have talked about the posterior triangle using the schematic diagram. So, in today's video also, we'll be starting with the concept of anterior triangle with this schematic diagram only. So here we have a muscle called as the digastric muscle. This digastric muscle is originated from the digastric fossa. Where is the digastric fossa? On the posterior aspect of the mandible we have digastric fossa at the chin or at the symphysis menti. From there we have origin of digastric muscle. So this digastric muscle has two bellies, the anterior belly and the posterior belly, right? So I'll be representing them like this. So this is the anterior belly of digastric muscle, and this is the posterior belly of the digastric muscle, which is attached to the mastoid process. So this is the digastric muscle, and you can clearly appreciate that this digastric muscle is has divided the anterior region of neck into triangles. You can see this is the one triangle here, this is one of the triangle, this is one of the triangle, and even this is also one of the triangle. Now we'll name these triangles one by one. So first I'll be naming the muscles here. So this is the, it's too big, this is the anterior belly of digastric, right? And this is the posterior belly of digastric. Okay, now here, look here, this triangle, this one which I am highlighting with the laser, this triangle, it is known as the submental triangle. Okay, this triangle is the submental triangle, and this triangle, it is the digastric triangle. This is the digastric triangle, and this one, the triangle which I am highlighting, this one is the carotid triangle, and this one it is known as the muscular triangle. It is the muscular triangle. So now we have got all our anterior triangles, the submental triangle, the digastric triangle, the carotid triangle, as well as the muscular triangle. So all these four are the anterior triangles. Now in this video we'll be talking about the submental triangle as well as the digastric triangle. Submental triangle is not that much important, it's small, so we'll be talking about digastric triangle in detail. So first let us start with the submental triangle. So this is a submental triangle. So what are the boundaries of submental triangle? You can appreciate here in the diagram, the apex, it is the symphysis menti or chin, and base is the hyoid bone, and laterally or either on each side we have the anterior bellies of digastric muscle, and floor, it is formed by the mylohyoid muscle, and roof is formed by the investing layer of deep cervical fascia. So these are the boundaries of the submental triangle. Now what are the contents of submental triangle? Submental triangle has submental lymph nodes as well as the submental veins. You can appreciate them in this diagram. So these are submental lymph nodes and these are the submental veins. So this is all about the submental triangle. Now let us talk about the digastric triangle. You can look here, digastric triangle. So this is the digastric triangle. So we'll study it in detail. Now what are the boundaries of this digastric triangle? Before that, this digastric triangle is also known as the submandibular triangle. Okay, now what are the boundaries? Antero-inferiorly we have the anterior belly of digastric. You can appreciate here. So antero-inferiorly, anterior side on the inferior aspect. So this is the antero-inferiorly we have the anterior belly of digastric. Now posterior-inferiorly we have the posterior belly of digastric, and the base of the triangle is formed by the base of the mandible and an imaginary line drawn from the base of the mandible to the mastoid process. So this is the base, and apex is the intermediate tendon of this digastric muscles. I hope you guys are clear with the boundaries. Now what is the roof? Roof is formed by obviously skin, superficial fascia and deep fascia. So the superficial fascia contains platysma, cervical branch of facial nerve and anterior cutaneous nerve of neck, and deep fascia it splits and encloses the submandibular salivary gland. Now what does this exactly mean? See, suppose if this is the submandibular gland, this fascia it comes, just a second, it comes like this, it gets splitted and it encloses the submandibular salivary gland like this. So the deep fascia it splits. Now floor is formed by the mylohyoid, hypoglossal muscle and the middle constrictor of pharynx. You can appreciate the floor here also. So this is the mylohyoid muscle, and this is the hypoglossal muscle, and this is the middle constrictor of pharynx. Okay, I hope you guys are clear with the floor. Now comes the most important aspect, that is the contents. Now even this digastric triangle, it is divided into anterior part as well as the posterior part with the help of a ligament called as the stylomandibular ligament. So the stylomandibular ligament divides the digastric triangle into anterior and posterior parts. Now what are the contents in the anterior part? We have submandibular gland, so we call it as submandibular triangle. Okay, so we have submandibular gland, we have facial vein. If facial vein is there, obviously artery also will be there. Next, submandibular lymph nodes, hypoglossal nerve and mylohyoid nerves and vessels. Okay, you can appreciate this in this diagram. So this is a schematic diagram which I have tried to represent the contents. So this is the anterior part of the triangle. So anterior part of the triangle contains, this is the superficial part of the submandibular salivary gland. So these are submandibular lymph nodes, and we have mylohyoid nerves and vessels. We have facial artery accompanying with the facial vein, and we also have the hypoglossal nerve. So I want you guys to represent like this only in the exam. If there is a question of digastric triangle, try to represent like this only, because in textbook the diagram is not that much clear. So I have drawn it schematically. Now what are the contents of the posterior part? So this posterior part again can be studied under superficial contents and deep contents. The superficial contents are parotid gland and external carotid artery. We cannot appreciate parotid gland in a 2D diagram. In 3D or in the dissection, we can clearly see that the posterior part superficially contains the parotid gland, and we have, this is the superficial part, we have external carotid artery, which I am highlighting. So that is the external carotid artery. And deep parts, you can remember the deep relations of the posterior part, or the deep contents of the posterior part, with a mnemonic as GPS. G for glossopharyngeal nerve, P for pharyngeal branch of vagus nerve, and S for styloglossus muscle. And we also have stylopharyngeus muscle and internal carotid artery. You can appreciate them here. So from the styloid process to the mandible, we have the styloglossus muscle, whereas from the styloid process to the pharynx, we have the stylopharyngeus. Simple, right? Along with that, we have internal carotid artery and glossopharyngeal nerve, and we also have the pharyngeal branch of vagus nerve, which is somewhat difficult to represent in this diagram. So this is all about the contents of the digastric triangle. Okay guys, so if you have any doubts, please do comment in the comment section, and don't forget us to follow on Instagram and Telegram channels, and you can directly DM us your doubts in Instagram also. Thank you for watching. Have a good day.